A lot of people often ask the difference between the birth center setting versus the hospital. To me personally, I view the birth center setting just as more holistic care of the whole woman. So we can see women for their annual exams, we can see them for GYN visits, preconception counseling, all the way through pregnancy and delivery and postpartum and menopause. So we can see them through their whole life. And then when it comes to pregnancy and delivery, that's the biggest factor what people ask about, right? At the birth center, we specialize pretty much in natural birth. If a patient wants an epidural, we have that ability to go to the hospital with them to get them the type of pain relief they want. But when they're here, we have a lot of freedom to help them cope with labor in different ways. So we have the tubs, we can do nitrous, we help them a lot with different positions to help them get more comfortable. And since we are with them through kind of a more natural labor process, and we do it often, we have the techniques and the abilities to help coach husbands and help her just learn her body and learn how to cope and get through it. Difference is big, and also the monitoring aspect. So they have a lot of freedom of movement here at the birth center, so they can be in the bed, they can be in the tub, and they're not hooked up to monitors, so they have that flexibility to not being kind of limited to a bed or one single position, which a lot of ladies like a lot. And then the biggest thing too is just postpartum. So they stay with us for about 4 hours if everything looks good and mom and baby are healthy, and then they go home. So that people love because they get to go home to their own bed and be cozy and just kind of bond with their new baby without being interrupted with vitals and everything that's kind of routine at a hospital. And then one of our nurses goes out to their house and sees them at 24 hours after delivery, and they do all the newborn exams, help with breastfeeding and all of that. And then they actually come back here for a 1-week breastfeeding support visit as well. So it really just gives them a lot of support, which I think can get missed in a different environment because they're not always getting followed up with at 24 hours or having that support and having a nurse they can text with questions, or just not seeing another provider until their 6-week visit. So knowing that they have all of this resource here with the different nurses and midwives, and that they can reach out for help and reach out for some support with nursing or if something's challenging, I think that is good as well, to just know that they just are more supported, I guess.